So, good afternoon, everybody, and welcome to this talk on the BSc in Clinical Pharmacology. I'm Dr. Atiq Hayat. I'm one of the lecturers on the course, and I particularly teach drug development. I also have a small lab where I do cancer research, and my particular interests are um, breast cancer. In this talk, I'll tell you more about the BSc Clinical Pharmacology and some other associated information. On the call we have with us is our year three student, Callan, who is going to also be representing the BSc Clinical Pharmacology and telling you more about what the experience has been like studying for this program. So I hope that I'll tell you more about the clinical pharmacology degree at City St. George's, what the course is actually composed of, and the kind of careers it may potentially lead to. Careers plus further study. Now, the first question is, what actually is clinical pharmacology? And basically, you can find many different types of definitions, but one that really suits our course is that it is the science of developing new medications for use in healthcares, such as the NHS. It encompasses a variety of different fields, for example, from understanding basic fundamental biology on disease mechanisms, on how drugs or medicines are discovered, how they're tested in animals or cell models, and how they go into these clinical trials where the drug or the medicine is tested in humans for the first time. Furthermore, how these medicines are then given and prescribed to patients in the hospital or a healthcare setting. So, as you can see, clinical pharmacology encompasses a variety of different definitions, and it's a broad spectrum of learning from compliance to pharmacokinetics to drug development to how drug-drug interactions work, how drugs interact with food, the side effects of particular drugs, and the diseases that may be associated with particular drugs, and how particular diseases are treated with medications. You might be wondering, where does clinical pharmacology actually sit in terms of the degree? Well, clinical pharmacology is a basic science degree. For example, biomedical science is a basic science degree, and so is clinical pharmacology. That means it is different to a healthcare degree like pharmacy or medicine, or for that example, dentistry. Clinical pharmacology is more relevant to pharmacology itself. Uh, for example, but what you find is that clinical pharmacology students can go into medicine and can go into become pharmacists if they want to study further. And this is something that we will touch upon towards the end of this presentation. So the main objective of this program is to develop graduates that are ready for work or further study in drug development and healthcare setting. That's the overall overarching aim of this program is firstly that you do not really have to study further if this is where you want to end with your education, because we believe that we create graduates that would be able to work in drug development companies such as Pfizer, GSK, and so on and so forth. Now, this program is continues for 3 years. There is an option to take a professional year out to work in industry. Some of our students actually decide to do that. Every year, we might have anywhere from 1 to 4 students that would go on this optional professional year. But essentially, in year one, we know that students come from different backgrounds that might have studied a variety of different subjects. So we start with some really basic concepts in year one where we introduce them to clinical pharmacology and the various modules that exists in there. Students will do a short project in year one and in particularly in semester one, towards the end of semester one. Furthermore, they then develop on these introductory module and go into learn more about drug targets and ethics and how drugs go from one place to the other in terms of the drug development pipeline. hopefully when when year one is completed and students are able to progress to year two, students then develop on these basic concepts that they have learned in year one, and then they would then have to apply this knowledge in year two, which is slightly more challenging. But I suppose the most exciting part of this degree is the second semester of year two, where it's all practical work. So they do a research project which could take place in a laboratory, it could be in the hospital, or it could be an external project outside of the university or within the university as data analysis. Students, once they finish their research projects, they then go on to conduct some work experience. And again, this work experience could be within the university, and we have various collaborators outside of the university, and in fact, outside of the country, where students are sent to conduct work experience. Again, these might be in pharmaceutical companies, in the hospital, in the university, or within the course team who have developed a variety of exciting projects from bioinformatics to others for students to work with and learn new skills and develop new specialized knowledge during those work experience months. As we said, there is then an optional professional year for students. And I already said that only few students are able to take that. In year three, the students learn about something called hot topics. These are contemporary topics, newer, novel gene therapies and medicines, and novel diseases with novel therapies where students learn about them in depth by somebody who is particularly interested in working in those areas. At the same time, they will also be doing a third project, which is in the form of a written research project. Again, they learn to analyze complex data and are able to produce a longish report on their chosen subject. Students will then have an option to select an optional or several optional modules in the last semester of their year three. And there they will go into an in-depth interrogation of a topic that largely interests them. And we found students are really engaging and they love the final semester of their course. And hopefully, students would then be able to um, graduate after that. Now, what are the modules that students learn on this program? We have 6 core modules plus one, which is known as the skills portfolio. So students learn about the fundamentals of science, pharmacodynamics, which shows how drugs work, pharmacokinetics, in where you learn how the body handles the drug development, all the way from drug discovery until the drug is approved and given to patients in bedside. We then learn about how these medicines are used in healthcare, such as the NHS. And of course, we learn to do some data analysis in data and statistics module. The skills portfolio module is a complementary module to all of the other 6 thematic modules, in the sense that in there you learned these practical skills, these soft functional skills, like working in the laboratory, learning how to clinical trial skills or learn how to present well or debate well, or how to work in a team effectively. Again, so this is a 3-year degree, and the first year in semester one is quite introductory. You then learn on particular biological processes or organs like heart, inflammation, infection, metabolism, and then you learn about more specific diseases like cancer or central nervous system related diseases, and so on and so forth. And as we said, you then go on to do a research project plus some work experience, where you then advance to year three to learn about these contemporary topics and these optional modules. And what's really nice about this program is that these 7 modules run together at the same time. We don't really do study blocks. All of these modules are done together and they run together because they're all bounce off each other. And something that you learn in, let's say, in fundamentals of science may well come up in drug development as well. So how will you be learning? Well, there will obviously be lectures, which means that you will come in, sit in a class, and a professor would be delivering lectures. But what we believe in on this program is that learning should be highly engaging, where students actually participate in the class. So we have a lot of practicals like lab practicals or clinical trial skills, but also these workshops where students do things like quizzes, short worksheets, or other assessment types. In the data and statistics modules in particular, you will also do data handling. Um, we also conduct these small group teachings where we separate you into about 10 to 13 students and you meet a particular professor every week and you go through specific learning programs or specific activities that take place in these small group sessions. These are very informal. You learn new things, you really brush up on these soft functional skills that we mentioned before in terms of uh, presentations and debating and critical thinking and so on and so forth. And in addition to that, we also offer employment skills and careers advice throughout the 3-year program. So again, this is how a typical degree of the BSc clinical pharmacology looks like. You arrive in year one, you do your first project on a particular practical or laboratory project that we have organized called the aspirin practical. You might also be doing Dragon's Den, where you present in front of a large cohort of people. You also then do podcasts, do research papers throughout year one. These are just some of the skills that we have picked up from our program. In year two, again, we do some more specific educational works like clinical trials, um, more specific diseases like cancer and so on and so forth until you end up with a project and a work experience in year two. In year three, you do these hot topics in clinical pharmacology, followed by a lot of employability work, because this is the time where you might be applying for a number of work placements after or further education. So we help you develop these employability skills, including CVs, personal statements, and interview practices. This is just a typical timetable, although it might be very different every single week. I think this is what's really nice about this program is that every single week is a little bit different. So you might have variation in the modules that have been taught, the timing it starts, and who essentially teaches it. But you essentially begin with on Monday more sort of practical aspects because these are the days where you have to be in at the university, including Thursdays and Fridays on year one. Tuesdays are generally reserved for studying from home. These might be self-paced learning or a lecture that is going to be happening online. Wednesdays are generally off, but you might also have pharmacy visits. And in order for you to interact with the faculty of the BSc Clinical Pharmacology and other students, we use a virtual platform called Canvas. And essentially, there you will find all of the lecture PowerPoint slides, all of the recordings of the lectures, information on exams, courseworks, assignments. There you will find your up-to-date grades as you progress through the years and some other resources that might be really important for your learning. Now, in terms of how much each of these um, years count towards your degree, in year one, it doesn't count anything towards your degree in the sense that it you would still need to pass it, but it doesn't count towards your overall degree. Year three counts 30%, and year three takes the biggest chunk at 70%. And 50% of those grades come from the in-course assessments. These might be, again, things like assignments, presentations, um, and other or quizzes and other in-course assessments. And the other 50% comes from the exam. In year one, the exam takes place at the end of the year. In year two, the exam takes place at the end of semester one. In year three, you will have two sets of examinations, one in the at the end of the first semester, and one at the end of the second semester or at the end of the year. And in order to progress from one year to the other, you have to be able to pass each module at 40%. That is the bare minimum. Now, you have I think what's really useful for students to know is that this course is run 50% of the people who teach this course are scientists who work in the lab, who are working on the cutting edge science in various diseases, from diabetes to heart diseases to cancer and neurological diseases. And the other half are clinicians. These are doctors who work in the hospitals, consultants, pharmacists, etc. So what you learn is that you find that you're in sort of the best part of both of the worlds, in the sense that not only do you understand or get insight from these basic molecular biologists, but also how and the way things happens in the hospitals as well. And the kind of careers that this program leads to could be many. These are data scientists, laboratory scientists, medicinal scientists, and some of our students go into study further in terms of they would like to study medicine or do masters or PhDs, and students have been able to do that. Again, as you can see, these are the kind of careers that students go into: medicine, drug discovery, clinical trials, pharmaceutical companies, marketing, scientific writing. And what we have found is that our courses are top across the country in 4 themes in 2023. In terms of admissions, um, we the minimum entry requirement grades are triple B, including either biology or chemistry. And we want students to have 5 subjects of GCSEs at grade 6 or above, which is equivalent to a B or above. Our university, as you would know, has merged, or St. George's and City University have merged recently, and we think that this is a fantastic opportunity. Where combined institution will constitute a health powerhouse for students, and is now called City St. George's University of London. There is just more scope for collaboration, more projects, and so on. Thank you very much for listening, and I'm happy to take any questions that you might have. But before I do that, I'm now going to pass on to our student representative, Kalin, to tell you more about her experience of the program. Thank you. Kalin.
Thanks, Atik. Hi, everyone. My name is Callan. I am currently in year 3. So before I started clinical pharmacology 2 years ago now, so September 2023, I was very nervous about going to university straight from A levels. And I was very worried about what the jump was going to be like going in from A levels straight into clinical pharmacology. But what I found was that the course team was really helpful, and that the progression from the foundation that I learned in A levels to the beginning of university was very gradual. And it, the course team basically ensured that everybody was on the same playing field when we did start learning about content. So we, started with the basics in biology, basics in chemistry, just to make sure that everybody knew exactly what you were supposed to know for this course. Excluding that though, for the past 3 years basically, I have been learning and developing how to balance studying, work, life, hanging out with my friends, meeting people, going to societies. And my key thing that I've been doing to ensure that is by making a schedule, sticking to that, but also just allowing room for spontaneous things, for mistakes, because it all happens, it always happens. Um, but I also wanted to talk a little bit more about what from this course I've actually gained, because obviously we're paying money to come to university to get a really good degree, to learn, to get a good education. And what I've taken away from the course so far is that I've been able to do so much. I've gotten so many different opportunities coming to clinical pharmacology. I have been a year representative for this course for 3 years, for 3 consecutive years. So year one, year two, year three. I've developed so much of my lab skills, my lab technical skills, clinical skills like ECGs, communications. I've also been able to get a lot of career advice from the course team itself, but also from a careers advisor in the university. I have been able to be part of this amazing thing that we have called Dragon's Den, which is like a project presentation that we give on a upcoming drug to a live panel of judges from industries. So it's been really fantastic to develop those skills right from the get-go, because that was in first year. Excluding that, in second year as well, you have the opportunity to go and work in industry for 6 weeks. So during the 6 weeks, I actually did the Turing scheme, which is a fantastic scheme where you can actually go abroad and work in a little lab, work in a lab, learn some more technical skills there. So I actually went to a lab in Italy, and I was only able to do that because I came to clinical pharmacology. So there's just so many different opportunities available in our course, and the team are there to support you. The course team are there to support you. If you are ever struggling, this is my top tip. If you're ever stuck, if you're ever struggling, don't be afraid to speak to the course team. They are always happy to help. They can be really, really helpful when you're struggling to actually understand the content, but also excluding from that, if you want to do a few more things outside of the university, outside of academics, they're really helpful with finding different opportunities available. So those are my top tips if you do come and join clinical pharmacology, because it is the best course out there.
Thank you very much, Colin. I really appreciate all of the comments that you made, and I hope that that gives a good representation of what life would be like to study with us. Thank you very much.